Hey everybody, welcome to the live stream. We are super excited to be talking about Low Vision Awareness Month, and we are inside the Association for the Blind and Visually Impaired. We're in their conference room. You can see some of the equipment that they have around, a lot of visual aids and some history up on the wall too. We've got two great guests that I haven't had the chance to talk to before, and I want to introduce them to you and our community. So we've got down on the bottom screen, we got Dr. Lori Smolinski. She is a low vision optometrist with 24 years of experience. Dr. Lori, thanks for joining us today.
Thanks for having us.
And then we got Colette over here on this side on the right. So Colette Mattox, she is a certified vision rehabilitation therapist, and you've been working here at ABVI. Thank you so much for joining us as well.
Thanks for having me.
So Dr. Lori, I want to just know, tell me a little bit about how long you've been working as an optometrist and how long with low vision clients.
So I graduated from the Michigan College of Optometry in 2000, and I started working here very shortly after that. I just basically had to wait for my license to come through. I did one of my clinical rotations focused on special needs patients and low vision patients of all ages. And my last year of optometry school, in the actual school, we did quite a bit of low vision there as well. So yeah, I've got about 26 years of experience with low vision.
Oh, that's great.
And then I spend about half of my week doing regular primary care eye exams as well.
Yeah. So just how great is that to get involved in the community, to have your regular practice, but then come here and work with the clients here at ABVI?
It's really been kind of a perfect balance for me, because then I can stay active in regular optometry and know all about all of the procedures that people are having before they come in to see us in low vision, all of the treatments, knowing all of the research that's out there, all the pharmaceuticals. So yeah, I'm on top of both fields.
That's great. And then Colette, what is a low vision rehabilitation therapist?
Great question, Chris. So I take the recommendations from the low vision exam that Dr. Smolinski or Dr. Michelle Bouillon give to me, and I assess the patient, get to know them a little better, see what they are having difficulties with in their daily life. We call it activities of daily living, due to their vision. And then I simply provide the skills and the techniques to assist them in accomplishing those goals and living as independently as possible.
That's excellent. And then how long have you been working with the team or working in the industry?
Yeah, in about 2 weeks, it'll be a year.
Oh, nice.
So,
Congratulations.
yeah.
I bet that's fun, hitting that milestone there,
Yeah,
the year.
great.
So, Dr. Lori, what are some of the key differences between a standard eye exam and what you offer here at ABVI, a low vision exam?
Sure. In a regular comprehensive eye exam, you think of getting your eye pressures taken, you think of getting your eyes dilated, maybe some photos of your eyes, doing a refraction, which is better, one or two, seeing if you need new glasses, checking your eye muscles, somebody looking at your eyes under a microscope. So diagnosing and treating eye conditions. By the time someone gets to a low vision exam, they've already had all of that done, and we're not really interested in repeating most of that. We're basically trying to enhance whatever vision is remaining. And sometimes somebody who comes to us has 20/20 vision, but they are really light sensitive, maybe from a brain injury. So we might be talking about tinted glasses or some techniques to help with glare sensitivity. Sometimes it's more of a peripheral vision loss. So lots of different things can cause someone to need a low vision exam, and we are ready for all of them.
And why is routine eye exams just so important for everybody, even if they don't even think they have low vision or just regular life?
Sure. We are big advocates of preventative eye care. So as a profession, optometry hasn't really done a great job of telling everyone you need to have an eye exam at least every 1 to 2 years. The dental profession has done a really good job. Everyone knows get your teeth cleaned every 6 months, but for some reason, eye care has fallen in the cracks. One of the biggest reasons is glaucoma, which is one of the biggest reasons we see people in low vision. So glaucoma is a terrible eye disease that usually does not have any symptoms until it's far along. So it's almost always just caught during a routine eye exam. So that is a condition where you have high pressure in your eyes, but usually not enough to cause pain or headaches or blurry vision or anything like that. So when we see people in low vision who have advanced glaucoma, a lot of times they will say, I didn't know I had it because I was buying glasses in the drugstore to treat my older aged eyes, if you will. And I didn't realize that I had this condition until it was too late. It's really devastating. And then for children, they get vision screenings in school, but a lot of things fall through the cracks there as well. A lot of learning disabilities, reading disabilities are actually visual impairments, kids that have trouble tracking, eye muscle issues, lazy eye, a condition called amblyopia. So your child might have one normal eye and one eye that is poor seeing. And the younger you address that with patching and vision therapy and glasses and so forth, the more successful it is. So really, children should have an eye exam by the first year. Usually around age 3, we can get some really good information. And then again at age 5, and then yearly after is really recommended.
So you heard that here from Dr. Lori. Get your regular eye exams once every 1 to 2 years, or what do you say?
2 years is the max.
Okay. Get your regular eye exams, everybody who's watching. So Colette, after Dr. Lori has worked with a client and had her first exam, what's the next steps and how you work with them?
Yes. So I really want to highlight that we are a goal-based organization, correct? So that means that everyone's goals are very different and personalized. So I simply, I go over into Dr. Smolinski's eye exam room. I literally take them over across the hall, have a seat with them, get to know them a little better, like I said in my first question. And then in conjunction with the devices or techniques recommended from the low vision exam and the answers that they provide for me as far as their activities of daily living, which it could be something as simple as I struggle signing my name, or it could be something like I go out to eat with my family and I can't read the menu. So I am trained to, depending on how they answer their questions and, other comorbidities or whatever that they may have. I'm trained to either teach a low tech magnification option all the way up to patients they may have no light perception. So every person's different. Every scenario is different, and we work together as an interdisciplinary team to help them accomplish their goals. And that's what I do right after the exam.
That's so great. Just the interdisciplinary. We talk about that at Mary Free Bed, just having all the disciplines working together to help the patient, just be very, holistic, looking at the whole person.
Yeah.
So Dr. Lori, we talk about low vision, but awareness about it is pretty limited. What's like the percentage of people who live with these low vision conditions that we just don't talk about as much?
Sure. There was a study done in 2022, and it showed across Michigan, there was a little over 2 to 8% of older citizens who have some degree of vision impairment. So the average ended up being about 5.6%. So across all counties in Michigan. And nationwide, about 12.5 million people have some degree of vision impairment if they are over 40 years of age. So that's a lot of people, especially considering how few low vision providers there are in our state. There's only about 15 of us who have the low vision certification that I have. Wow. Yeah.
So, because the Association for the Blind and Visually Impaired, it's how many counties around West Michigan do you
We
guys
cover
serve?
13
Yeah, I think that was the
counties.
number. Wow.
Yeah. But people outside of that range are welcome to come and they would see Colette and I. It's just that we can't offer a home visit to them. But if they need further follow-up, they come back to our office and we deal with it that way. We routinely have people outside of that 13 county range.
Well, that's just so great to have your organization here to be a resource for people. So Colette is talking about this like distance. A lot of people who have low vision, they experience isolation. How does coming to work with you and the team help them both practically and then also on like their social aspects of vision loss?
Yes. So piggybacking on my response from the second question, situations like going out to eat with their family and friends. Some people decide not to do that because they don't necessarily want to ask someone to read the menu for them, or they have difficulties identifying things on their plate. I had a lovely lady last week. She was in a bridge club and she stopped about 6 months ago because she couldn't see the cards. So my part in doing that was simply the lady last week, we played a quick little round with large print cards, and she was so ecstatic about it. And I just saw her yesterday for a home visit, and I followed up. I said, did you have the opportunity to go into your group and play? And she said it was a wonderful experience. Her friends were supportive, and she's back in her group. Situations like going out to eat with their family. It could be something, like I said, as simple as just a magnifier. So I challenge people often to use these devices, these tips and tricks, and just simply being open-minded and trying it, and you just might have fun. And they do, and it all ends up working out. That is my part in kind of assisting with that isolation. Now, I can't take all the credit for isolation, helping with isolation. Like I said, we have an interdisciplinary group here. So the patients also have access to counseling through Mary Free Bed. If people don't know that losing their vision can be a form of grief. Vision is a very dominant sign. And so when you wake up one day and it is different than what you're used to, it takes a lot to adjust to that. So when we experience and assess a patient that may be having concerns about that, they know that there are options out there to talk it out. And we also have what we like to call support groups. Our client advocate and our social work interns often provide social groups once a month, and we have them in different counties. Like there's a Muskegon County group, a Kent County group. We have options of over the phone or in person. And it's just a time to be around like-minded individuals that experience the same difficulties. You can bounce ideas off each other. Just be supportive for each other. So that I've seen since I've been working here has really assisted with isolation.
And that probably is what helps fill your guys' buckets when you feel those and hear those stories of people getting back to their life in their community. I bet that feels great to hear that, right?
It is. It's not only beneficial for the patients, but for us as well.
So, Dr. Lori, we've talked a little bit about glaucoma, but also things like macular degeneration. How can some of the work with you and these low vision exams help with those conditions?
Sure. So macular degeneration is the number one condition we see in this agency, and it's just because it's so prevalent. And it's actually very amenable to low vision treatments. So with that condition, you basically have some sort of void in the center of your vision. It might be distortion. It might be a missing space, something like that. People will say things like the words run together. I need things very black and white to see them. I need to carry around a flashlight. Those things, Colette and I know we can fix that. We've got magnifiers, we've got technology for that, we've got techniques. So there's lots that can be done. And sometimes we see someone in the clinic who is newly diagnosed with a condition like macular degeneration, and we really enjoy seeing them as well. We know that they're being proactive. They want to come in and know what's out there before they actually have a loss of vision that they can notice on a daily basis. And we welcome that too. A lot of times those visits are more just education and showing them things that they can use down the road if they ever need it. Glaucoma is a little trickier in that it's case by case. Some glaucoma patients are really light sensitive, some need a lot of light, but with our experience and our array of tools, devices, techniques, technologies, we have lots of things that we can try with patients with any ocular condition, really.
That's great to have all those tools in the toolbox to help the clients that you're working with.
Yes.
Colette, so we mentioned a little bit too this in-home services. Can you share any examples of how you've worked with people to help them maintain their independence despite their vision challenges?
Yes. So, most patients that we see in the low vision clinic, I'm usually able to train them or give them an assistive device, and it's like a one and done situation. But occasionally, we do have people with multiple goals, and I follow up in doing a home visit. Home visits are wonderful because most people who have low vision or degrees of blindness cannot drive. So it is a convenience for people. Some people are also very intimidated when they come into the clinic, but when I'm in their home, they seem to be more relaxed, more interested in the services and whatnot. People perform better in their homes. For example, one of the things that I do for individuals is labeling their appliances. Appliances like their washer and dryer, their stove, their oven, their microwave. People who experience low vision have contrast sensitivities in some cases. So those types of devices and appliances blend in for people. So they can't determine their 30-second button, their minute button. So I come into their home because I can't label their appliances in office.
Yeah.
I come into their home, and depending on what appliance they use the most, let's use an example of a microwave. I might label it so it's easier to identify with a bright orange bump dot. A bump dot is a raised, colorful sticker that comes in all different shapes, sizes, and colors, and that helps them identify. It could be used on a remote, thermostat, like I said, washer and dryer, those types of things. So it's not usually with one case. It's majority of my patients that I can do.
So it's probably good to get into their setting and really see the challenges they may have and how you can help that.
Yes.
So Dr. Lori, you said 26 years now you've been doing this, which is just
Yeah.
awesome. Like, how has our approach or your approach changed over the years? Are there some things that have changed a lot or some things that have stayed the same?
It has definitely evolved since when I started in 2000. Things that have stayed the same, we still want to make sure someone's got a good pair of glasses. So we start with the basics there. We don't sell glasses in our office, but if someone needs an eyeglass prescription, we write one. I'd say about 25% of the time someone walks out with an updated glasses prescription. But honestly, it's often because their glasses are in disrepair, not because their doctor who sent them here didn't find something. It's usually just logistics and needing new glasses. We're looking at magnifiers, we're checking vision. Those things haven't changed and aren't going to change. By far, what has changed is technology. In 2000, we didn't have smartphones. What was an app? We didn't have that stuff. There are so many pieces of technology that we can offer now. Yet it's just incredible how that has changed and has really changed the whole blindness community in general. So sometimes we have special open houses and workshops and things because we just can't show it to everyone all at once otherwise. So the approach to the exam has changed in that we spend a lot more time on education than ever before. I am someone who tends to do a lot of research about things, but it took me a while to figure out not everyone is like that. Even with Google at hand, if I was diagnosed with a condition, I would have become an expert on it. But I quickly found out some people thought that they would go blind from macular degeneration. Well, that's not true. You don't go totally blind from that condition. And I would say on a weekly basis, there's someone who has been afraid they were going to wake up and it would be black.
Mm.
And it's very easy to check for that and reassure them that is not going to happen with this condition. So simple things like that I've learned over time. Some of the conditions we deal with respond well to vitamins, and we talk about the importance of that. Some are really negatively impacted by smoking. Macular degeneration is one of them for sure. We used to ask the simple question, do you drive, yes or no? Well, we've learned you need to say, when did you last drive? Sometimes the answer is yesterday, and then that opens up a whole other can of worms that we need to address. So I've just learned a lot over the years that there are some questions that I thought would be common knowledge, but they are certainly not. Some people really don't understand what their eye condition is at all. They don't understand what the retina is. So we get out the eye model and we explain that. I often use the analogy, the eye is like a camera. And when you've got a problem with your retina, it's like your film is bad. So that's why glasses don't really cut it, and why your doctor has sent you to us, because we have other ways to try to compensate for that. I would say the other way the eye exam has really changed is a concept called contrast sensitivity. So it is basically how one object blends into its background, or practically how black and white do you need things to be to see them. So we talk about that concept a lot about driving, but in reality, a lot of the patients we see benefit from different colored glasses, and we have an incredible array of them in this office because we found that there's not a cookie cutter approach to that. You say the word yellow, well, there's different shades of yellow and different frames and different approaches to it. So Colette and I often spend a lot of time talking about just tinted glasses, which sounds simple, but it could change someone's life.
So Colette, we're talking about simple. What are some of the simple things but effective that you've done with people to help them in their daily life? We talked a little bit about when your home visits, but what are some other things you can do?
So yes, one thing I was going to draw light on was the tinted colored glasses. We have array of colors, and we also have like fit over sunglasses or tints rather. And it's like you can fit them right over your prescription glasses, and so you're not missing one or the other type of thing. Situations like people make lists to go to the grocery store or write letters, and they can't always see what they wrote because they're using a pen. You can use situations like bold writer pens. They remind you of Sharpies. It's a little bolder, a little easier to see because of the contrast. Things like signing your name. We have adaptations in the office, which you'll have to come in and see what they are.
Yeah.
But a simple thing would be if you're paying a bill at a restaurant and you need to sign the bill, you simply put like a credit card underneath the line, and you sign on top of the credit card, and the credit card at the top is the little guide for it.
Oh, that's great.
That's just naming a few things that I think is easy things. And lastly, technology.
Yeah.
So everyone that I know has come through, and they typically have smartphones. A simple thing that you can do if you don't have access to low vision care at that time, simply having a family member or a friend going in the settings, enlarging the font. iPhones and Androids have really, really optimized their capabilities in the past couple years, and just simply going into the settings or accessibility and just kind of playing with that can make a world of a difference.
That's great. As we're starting to wrap up our interview, we get a couple more questions. Dr. Lori, how important is, we've talked a little bit about driving, but like how does ABVI help your clients when it comes to these assessments that are required by the state?
Right. That's probably the most challenging part of my job, to be honest. Again, we do ask everyone about driving, and when we see children, we always address this. Parents want to know, is my child going to drive? Teenagers want to know, is that in my future? So we do discuss it with everyone. And I basically say the state has 3 things visually that they want to know pertaining to driving. One is visual acuity, what you can read on the eye chart. They have very clear cut policies about that. Visual field, what your side vision is like. We've got an excellent piece of equipment to measure that. And contrast sensitivity. So again, how black and white do things need to be? They don't have a minimum in Michigan. No states do, but they do have a spot on the driving form that the Secretary of State asks about that. So I don't know if someday they plan to have a minimum, but what I tell patients is if I have to fill those forms out for you, I'm just presenting facts, and the Secretary of State does with them what they will. But I will tell you, whether you want to hear it or not, where you stand. Are you close to losing your license? Would you already have lost your license had you needed to renew it? And we talk about things like when you have side vision loss, there's so much you probably don't see that you're not aware of. So it's a very controversial subject. Every state has different minimums. I've done a ton of research on low vision driving because I do feel it's really important and needs to be discussed. But what you see on the eye chart is actually very little to do with your risk for crashes. But side vision loss absolutely does. Cognitive impairment absolutely does. So we talk about those things and what to do with that information. It's something we definitely discuss. And I've been working with visually impaired drivers my whole career. I've got a lot to say about it if people want to hear it.
Yeah, maybe we'll talk more about that
Yes.
with you. So Colette, our last question that we're going to wrap things up with, for people who are watching this that want to learn more about ABVI, or maybe they have a family member, they themselves are struggling with vision loss, or a family member is, what would be your recommendations for like their first steps to start working with you and the team?
Sure. So my first step, we are drawing awareness to having routine eye care. Okay. Once you see your primary optometrist, and if appropriate, you're welcome to be referred to us by faxing over your most recent eye report. And then from there, our clinic specialist gives you a call to get you scheduled, kind of explain in deeper detail what our services are and how we can assist you. And my last piece is if you yourself are experiencing low vision or you have a family member, just be encouraged. Know that you are not alone. There are ways to help you with independence. And ABVI, we will try our best to help you with that. Okay.
Great. Well, Colette Mattox from ABVI, the Association for the Blind and Visually Impaired, Dr. Lori Smolinski, the low vision optometrist here. I want to thank you guys so much for jumping on the live stream. We've been talking for Low Vision Awareness Month here at the Association for the Blind and Visually Impaired of Michigan, one of the partners of Mary Free Bed. Thank you so much for watching. If you got more information, we'll put information that you can find to reach out to the team. You could also go to abvimi.org. Thank you so much for watching, and stay well.